You may ask why the director of an adult trauma center would be at something about children and violence. But at our adult trauma center, we take care of any children over the age of 14 and sometimes younger depending on their size and events. We take care of many more than 70 overall in that age group. Admittedly, some of those injuries are a little bit more in the criminal area. However, we see too many injuries due to accidents or somewhat unintentional issues. And in the age groups we deal with, suicide becomes a growing problem as well. And we do know that if a gun is easily accessible, suicide becomes much more common in those first couple of days when people are participating in it. So we certainly have seen the effects of this every day. In addition, my wife is a pediatric intensivist across the street at Children's Hospital and takes care of these kids and or helps inform their parents when they've passed away. So as a family, we take this home every day in terms of what's the violence that is happening. It is interesting, if you have very strong magnets that are harmful for kids, they get withdrawn after a couple of injuries or fatalities. A bed crib has problems, raising and lowering, I think there was 4 or 5 deaths, all terrible, but not really the scope of what's going on with our children and issues. Yet, as said earlier, the uproar, the angst is not there. We just think it should be. Again, it's not gun control, it's gun safety. We would love to be able to keep me out of business as a trauma surgeon. Unfortunately, I don't think that will happen, but we would like to decrease the violence. And that's why, as an adult trauma center, we would support this alliance and put all of our efforts behind it as well.